to demonize people for, getting plastic surgery or for not getting plastic surgery is just like kind of should stop. As a double board certified facial plastic surgeon, I'd like to react to this video by Megyn Kelly. It's called About Botox Filler and Women Who Don't Age Gracefully. Let's dive in.
Jennifer Aniston, one of the most beloved celebrities in the country, she does it too. She lies about it. From an InStyle magazine article in 2024, oh, Jen, she just like drinks a lot of water and she gets a lot of rest and she eats really well. She eats really clean. Okay, I'm going to tell you guys firsthand that I know a doctor who recently worked with somebody very close to Jennifer Aniston. That Jennifer Aniston recently had what is called a bilateral, what's it called? It's a bilateral like lower facelift. So they go in with cameras on both sides, like under the cheekbones.
It sounds like an endoscopic facelift. And we have a video talking about all types of facelifts that can be done and some of the more modern techniques. So make sure to check out that video if you're interested. And also, if you want to hear about why I stopped doing facelift surgery, please make sure to watch that video too. But yes, I think finally people are waking up to the fact that celebrities have been trying to fool us for a long time about, the work that they had done. And they often will report that it's all natural, or they had some sort of non-invasive, application of some serum that fixed everything, whether it's their hair or their face or their neck. But in reality, they're getting a lot of surgery. And of course, not all of them, but many of them do get procedures done. And I think when people watch some of my celebrity analysis videos, they realize pretty quickly that it's not possible to attain some of these changes just naturally. And no matter how much great water you drink or how much vitamin D you get, some of these changes are just impossible, especially, as we all age. So again, there's no shame in getting any procedures done, right? As long as you're going to someone who is properly vetted, has the right skill set, the right knowledge and experience to take on your procedure, I think then that means you're doing the best possible research and trying to maximize your chance of success with these surgeries, because we know that all plastic surgeries have risk, but you're trying to mitigate them by going to someone who really knows what they're doing and who has your best interests in mind. And sometimes that means saying no to a certain procedure, and that's okay too. But yeah, I think gone are the days of just celebrities being out there and fooling all of us, right? We know this stuff goes on, and some celebrities are now being more forthcoming about procedures because they know they'll be called out for it, and everyone will, know that it's very obvious. So they might as well, be truthful about it. I think it makes them look even better in the eyes of many fans and followers. But let's see what else they have to say here.
They go in and they just lift here. And what it winds up doing is it winds up stretching the mouth out like that. And you can't reverse it. And it's a bad procedure to have done, no matter who you are, no matter what your bone structure is, because it's not working with the rest of the face.
Yeah, I don't think saying that endoscopic facelift surgery is always bad. I don't think that is a fair statement. The incisions are fairly hidden, usually behind the hairline. And it could be a way to get some lifting done without those classic incisions that run around the ear. And for a younger patient, or for a patient who doesn't have much skin laxity in the system, it can be an appropriate choice of procedure. The issue is that when there's extra skin on the face, right, or in the neck, and you're trying to smooth things out, that skin needs to go somewhere. And so just lifting up isn't usually enough, and you need to go in and actually remove some skin. But you're not going to remove the skin all the way out here because you'll be removing a lot of hair with it. So that's where the incision is, around the ear, whether it's just behind the ear or sometimes in front of the ear. The purpose of creating a longer incision is really to resolve that skin laxity. So the more laxity you have, the longer your incision will be, and the higher the likelihood that an endoscopic approach just won't work for you. But it doesn't mean that it's always bad.
We have to try that. Hold on a second. Does it look good? How do I
Yeah, it looks great.
Yeah, of course, sometimes you need to add in some complementary procedures such as brow lifting, sometimes eyelid surgery. sometimes lip lift surgery. That's a procedure that I still offer in my practice. We do a lot of that here, and the purpose is to reduce that philtral length, and oftentimes you can add more fullness to the upper lip and expose some of those upper teeth, which can be a very kind of youthful type of rejuvenation. But again, you have to properly select patients for any of these surgeries.
Also, people are getting their top lip flipped up. They're getting their lip flipped up.
So just to clarify here, we have a video about all these different versions of lip enhancement, so you can check that out. But with what Megyn is saying here, a lip flip is done with Botox, right? Classically, when we say lip flip, that's a Botox procedure with a couple of units right at the vermilion border. It can give you very small amount, maybe up to a millimeter of eversion of that pink lip, but you have to be careful. It can change some of the functionality of the lips. There's also filler, right, that people get into the lips, and sometimes that can just, give a more fullness kind of appearance to the lips, but then you have to worry about that kind of duck lip phenomenon. A lip lift, which I think is what Megyn is getting at here, is an incision at the base of the nose, removing skin and everting that upper lip. Again, the downside, there's always a downside to any plastic surgery, is of course the scar. There's a scar at the base of the nose, but that scarring can be minimized with the right approach and the right hands. But of course, there will still be a scar in that location. And then sometimes that can be coupled with corner lip lifting, and that's when you have a curled in upper lip and you're trying to evert the edges. So that's some of the different options that are out there for addressing the lip, and specifically addressing the changes that occur with the aging process.
It's like the attempt to do the Kylie Kardashian big lip, but without huge injections, and it looks terrible. Don't mess with your lips.
Ooh, Megyn, that's harsh. We'll put up our gallery here on the side, and as you'll see, we have a lot of happy patients who get very nice, subtle improvements that look nothing like lip filler. They look much more natural and more balanced. And again, it's a wonderful surgery for the right patient. And sometimes when you do a facelift and you haven't addressed that longer philtrum that has dropped with time, then that can look out of place. But I hope they're not going to be just bashing on all plastic surgery because it has its place. And I think when done right, it can be, a really nice boost to one's self-confidence. And we'll see what else they have to say. But so far, they're anti all of these procedures.
No, especially like the space between your nose and
Kylie Jenner.
Lauren Sanchez.
Oh,
Lauren Sanchez.
I don't know.
I have an entire video on Lauren Sanchez and some of the changes that she may have undergone with her lips, and it's definitely not just a lip lift outcome, right? So make sure to check out that video if you want to hear more about, again, some of the specifics of what may have, led to Lauren's current lip appearance. But again, attributing all this to just lip lift surgery gone wrong is not very accurate here.
She needs to step away from the needles.
There was a picture of her in Paris that was published recently that was horrifying, because it gets to the point where they do so much pulling and stretching and filler and Botox. Like I feel like they lose any sort of tissue and you just see skin on bone.
If someone is happy with their appearance, which, maybe hopefully she is, calling, her horrifying is not very kind. Let's just put it that way. I think we just need to be careful with that, right? Because some people will be harsh when folks don't get any procedures done, and let's say they're really balding or they just have very saggy skin, and they can be called names. And then when people go and get something done and maybe to some people it doesn't look good, then they start calling them names. But regardless, I think we just need to kind of spread a little bit more kindness. Obviously these two women care about how they look, right? They have makeup on at a minimum. I'm not going to start speculating on their procedures, though we can make a video on that if you guys want to see. But most people care in some way about how they look. So if they're content with their appearance, whether they get surgery or don't get surgery, or use makeup, don't use makeup, let's not start calling them names.
Well, and then what you get, not to be cruel, but like you get some weird bumpiness. Have you seen it? Like there's some weird bumpiness that it's almost like the tell. I think that they've had a facelift, or I don't know, is that filler left over? I don't know what that is.
I don't know what that is, but my doctor friend who can diagnose this stuff a mile away is always sort of like that. So that thing that Jen Aniston had, she said allegedly had, is not reversible.
Well, in general, plastic surgery is not completely reversible. You can do revision surgery to try to adjust things, but some of the impact, let's call it, of a specific surgery, wherever it is on the body, will still leave some degree of scar tissue at a minimum that you cannot necessarily reverse. And if you remove too much skin, some areas are more amenable to skin grafting to try to replace that skin than others. For example, the upper eyelid, if too much skin is removed, and a person might have difficulty fully closing their eye, let's say, or it just aesthetically doesn't look right, you can put some skin back in that area, and you can find thin skin in other parts of the body that can be appropriate for that area, as opposed to a lip lift where, this skin is very thick skin and it's hard to find an exact skin match for this area. Plus the scarring just wouldn't look good if you just put skin back if you've removed too much with the lip lift surgery. So, but most of these things are fairly permanent. So what they're describing is not just a factor of, facelifts you cannot reverse. I mean, all plastic surgeries to some degree are not fully reversible, though you can usually go in and make some adjustments if need be.
There's no doctor you can go to now. Allegedly, remember when Demi Moore did that?
It was
horrifying.
Horrifying.
And her face was like
it was like for Balenciaga or something like that.
Yes, and she looked like an alien, like her cheek. So my doctor friend told me, I thought that was misdone filler. It was a botched facelift. Oh. And she said everybody in their community knows the doctor in New York City, allegedly, who did that to her, and knows the doctor in New York City, allegedly, who fixed it.
Mm-hmm. I mean, you'd have to. I can't believe she went out and about in the world with that terrible facelift. I mean, it looked awful.
We have a video on Demi Moore's potential plastic surgery journey. So if you're interested in watching that, it's from about a year ago, but I think it's still relevant. So you can go and check it out, and I think it'll be a bit more informative.
I don't know. I think Demi Moore is probably like kind of addicted to all the plastic surgeries because there's been so many reports about like doing the arms and doing the legs and doing like the crotch, and like you can get all the, I mean, not crotch specifically, but you remember when she came out, was it for G.I. Jane or whatever, but she kind of had a resurgence after a low period in her career, and she looked, 15 years younger.
Yes.
And there were all these reports, which she denied, they never confirmed them, that she'd had everything operated on, like hikes in the arms and hikes in the legs and hikes in, I don't know. A friend of mine had the leg lifted, like the leg, so that the knees don't look old. And she said, don't get that, because she said, she laughingly said, I've got such bad scars now on like my bikini line that I can never ever leave my husband.
Oh my God.
Plastic surgery in general carries scarring risk, right? So you have to be ready for that when you go through one of these procedures, and it's kind of a trade-off. You get a scar, but you can remove extra skin or extra fat, right? So it's usually this type of a trade-off. And we did release a video recently looking at the Mar-a-Lago face, so something might be a little bit closer to home for this host at least. But so check that out, because on the political side, there's people on both sides of the aisle that are, getting some of this type of work done. So it's not like just a Democratic thing or a Republican thing. It's just people being people and trying to look their best. And sometimes that means going through some, less invasive procedures or more invasive plastic surgery to try to achieve their goals.
Or like wear a bathing suit that doesn't have like a matronly skirt.
Right. Or like the boy shorts now only, I guess.
Oh my God.
She's very open about what she's had done, and she had me in hysterics talking about this.
Oh my God.
But anyway, this nonsense of it's just my water, that is a bridge too far.
I love it. And in that segment, I closed with my favorite example of recent years, which was Giselle Bündchen in a burqa outside her, a head to toe burqa outside her plastic surgeon's office in Paris.
Yes.
Okay. And then 5 years later, she issues all these like cookbooks and like, I'm so pure, everything's pure, and I ride horses and it's just the sun and my athleticism, and it's not.
Yeah.
It's not. It's such a line of they sell to women, and I hate it. It's designed to make us all feel terrible about ourselves.
That's right.
Yeah, I mean, I do share that sentiment with these women. I do think that being a little bit more honest and forthcoming, especially when someone is in a position of authority and influence, I think is overall a good thing, and something that we'll continue to see more and more of, is my guess, especially as, you know, people who are younger now, who are, you know, influencers, and, you know, it's just more acceptable to get some of this work done, and then they share about it online. And remember that it's possible to go too far over in the other direction, where now we're oversharing and we're potentially influencing younger and younger people, you know, into getting some of this work done that they may not need and that they may later on regret. And that's probably my biggest concern as far as oversharing and being so open about, you know, everyone just getting these procedures done. And maybe some celebrities are trying to not talk about it and to reduce that type of impact on people. But I think like it's overall a better strategy to be honest. And it's also an equally important strategy that we should, you know, learn to feel more comfortable in our bodies and to be less judgmental towards others, so that you don't feel as obligated to get some of this work done, right? I think that's equally a goal. So I'm not a plastic surgeon who peddles people, you know, getting surgery all the time. I think if anything, it's better to avoid, unless, you know, someone really has done their deep homework, has, you know, really thought about a procedure for a long, long time, finds the right provider who can give them kind of exactly what they're hoping for. And that individual needs to accept risk of the procedure and that things might not work out perfectly. So all that's very important. And so to demonize people for, you know, getting plastic surgery or for not getting plastic surgery is just like kind of should stop. And, you know, I think we just need to take a more balanced approach to all of this. You know, I think that would help society as a whole.
And their own they won't own their own insecurities.
Well, they're
and
perfect.
confess it, right? They just born that way.
Born that way.
So on the knees, you know, as you get older, of course, your skin does start to drape, and the knees are a tell. And I recently saw a picture of Cindy Crawford and one of Melania Trump, where they both have the knee like starting to sag. And I thought, thank God. You know, it makes you feel better. I have it too. I did like 3 years ago have a laser tried out on my knee.
You can do that.
Yeah. My derm was like, yeah, you know, we could try that. And I'm like, okay, sure. It hurt so badly. She gave me nitrous oxide while I had to go on laughing gas. It hurt like a...
You see, I always talk about these aesthetic procedures as just being a spectrum, right? So on one end, you have something as basic as like cutting your nails or just super basic grooming elements. And then you got like makeup, right? You start to step it up and you have different creams and topicals, and you've got some of these less invasive things like machines, like what Megyn is saying with the lasers. You have Botox, filler, right? Radio frequency stuff. And then you start getting into surgical procedures, and that's maybe on one end of the spectrum. But there are plenty of times when it actually yields a more natural appearance than some of the other stuff that people do, which is interesting. But of course, it's going to carry generally more risk compared to some of these other modalities. But remember, something like filler, you know, in some parts of the face carries a real risk of causing something like blindness, which very few procedures on the face carry that type of similar risk, at least with that specific type of complication. So, you know, surgery isn't always worse than some of these other things that are out there. But of course, it carries real risk. So again, just something to remember. And as Megyn said, at least like the desire for that knee to look more youthful was there, or else she would never have gotten the laser treatment. But then she realized, hey, that hurts, right? And getting skin removed there is going to potentially hurt even more, especially in recovery. And then you're going to get scarring. And to her, it might not make any sense, but to someone else, it might be worth it, right? So again, we should just be a little less judgy and just accept that, you know, some people will do one thing, some people will do another thing.
It did make the knee look better, I'm not going to lie, but then it goes right back.
And that's the other thing, right? So surgery tends to have longer lasting results. So maybe a bit more impact on the body initially, but it typically lasts longer. Whereas a lot of these less surgical options are very short-lived, right? You have to keep doing them, and then that keeps costing money. And sometimes, like with filler, it can sometimes just look less natural if you keep building up that filler in the face, right? Pillow face, we call it. So anyway, pros and cons to each method.
You know, they can do amazing things with lasers these days.
Yeah.
I had a recent laser, I'm going to say maybe 6 months ago, and I was like, I have a pretty high pain tolerance, and this thing, this was killing me. It was killing. I was like, they were like, well, next time we could give you Valium. I was like, you should have started with that.
Yeah, right.
Okay,
why did you hold out?
For our surgical procedures under local anesthesia, which is usually the way we do our lip surgeries as well as our hair surgeries, I will always now require essentially Valium and or Ambien be taken by the patient, because some people come in, they're like, I don't need anything, I'm not stressed. And then you know that they're a bit nervous about the surgery. And sometimes they can get a little panicky. So we do like to give those medications before starting the actual surgery.
See, that's what I love. I love the lasers and I recommend the lasers, and I strongly oppose filler. You just look weird. It just makes you look weird. It doesn't make you look younger.
Saying that an entire modality is just bad, just like they were saying endoscopic facelifts are just bad, is really, in my opinion, a more primitive, sort of more ignorant way of looking at it, right? In reality, there's nothing intrinsically bad about filler. It's just that you want to use it in smaller quantities. You want to inject it in the right places, right? Instead of using a lot of it everywhere, and then you get a mess. Same thing with lasers. It's not to say that all lasers are just great, right? Because there's many different wavelengths of lasers. There's many different indications for lasers. Some people with darker skin, for example, cannot get the same lasers at the same energy as someone with lighter skin because it will cause pigmentation changes. The operator of a laser is just as important, if not more important, than the actual laser being used. You can use the most expensive laser, but if it's operated by the wrong hands, you can cause damage, right? You can cause real scarring to the skin. You can melt away extra fat, let's say on the face, right? Like there are real risks to any of these modalities, but there's a reason why the modalities are there, right? And they have their place in the aesthetic armamentarium. So to say that any one thing is just bad and the other thing is great is not truly understanding the ins and outs of how this stuff works.
By the way, there's no woman who's stuffed up with filler who you're like, oh, she's 30 when she's 50. Nobody thinks that.
No, and I think you have to go to a doctor. I love my derm because she's like, if you want something and I think it's too much or wrong for you, I'm going to say no. And I'm going to say no again. And
That's
you
what
can go
you
to somebody else, you know?
See, that's a really important point. I mean, I agree with her here, with Maureen on that, because some people will come to me, especially for surgery, and, you know, sometimes I just don't feel like they're an appropriate candidate. And patients can get very upset because they're like, well, I came to you for this. I trust you. I want you to do my surgery. I'm like, I don't want to do it. I don't agree with the aesthetics sometimes. Sometimes I just don't think they have the right anatomy for some said procedure. So, you know, going to someone who's willing to say no and isn't just like, yeah, as long as you pay me, we'll just do the procedure. I think that's really important. And so what she's saying about her dermatologist being that way, I think is excellent. And I think more doctors need to be that way in, again, the aesthetic space. But because like money is involved and it's kind of like a cash business, some people find it very difficult to say no, and they'll just do whatever people are willing to pay them for. But that's not the kind of person you want to be, going to.
Because I do think you can, once you start, it's like when you're renovating a house, right? Once you start seeing what's wrong and got corrected, all you can see sometimes are imperfections, you know, and your skin is like so, like, I'm like kind of in awe of like how you're, you know, and I love that you're open about lasers and extensions and like all this stuff. Like,
yes,
I will say, well done filler. Like I have gotten filler under my eyes for maybe the past 5 years. Oh. And it can, if it's done well, it can really correct, like if you're beginning to feel like you're losing
a hollowed out
a
feeling.
little bit, but the side effect of it is that you don't really need concealer anymore. Oh. It gets rid of the dark circles.
Now you're talking me into it.
Yeah, but again, you know, that's actually a very tricky place to inject filler, because sometimes you can get what's called a Tyndall effect, where the area looks kind of bluish. And sometimes you actually get a puffiness that develops, because remember, filler or HA filler in particular is like a sponge, right? So it'll attract water. And as that happens, you'll get a puffiness that forms. So if there's too much injected into the lower eyelid area, you can actually get this kind of bagginess that is difficult to deal with. And then you just have to go and dissolve the filler and all this kind of stuff. So some people are using PRF in that area, platelet-rich fibrin. We have a video comparing PRP to PRF and what the differences are. So if you want to check that out, but regardless of what you use, you can get this puffiness there. The lymphatics are easy to block in that area. And so it's a very tricky spot to inject filler into. But of course, in the right hands, it can be a good thing, and for the right patient, right? So again, I think she's starting to point out some of the nuances of these various treatments, specifically here, injectables.
Wait, does it hurt to get needles and that?
Not really, no. You just get numbed up. You just get numbed up. And you wait 30 minutes.
That's such a
you have
sensitive
an artist.
area.
I mean, it's going to hurt at least somewhat because you can't numb like underneath the skin, right? So the surface gets numb. There's also typically lidocaine within the HA filler. So as it starts to get injected, it's causing some numbness, but the initial pokes, I mean, you're going to feel.
I try to get 2 Fraxels a year, once every 6 months. And honestly, I just had one. I just had one last week. You couldn't even tell. I was on the air. You couldn't tell that I was post Fraxel. You don't really have much downtime.
You don't.
If you don't go like too crazy with it. And then in between the Fraxels, I'll have this little, it's called a Pico and a Clear and Brilliant from time to time.
It's a Pico.
It's nothing. I mean, it's a nothing burger. There's no downtime. It doesn't hurt. I don't even know really if it does anything, to be honest.
Yeah, I mean, usually that's what happens when something has like absolutely no risk and, you don't feel any kind of anything with it, no side effects, nothing. You have to wonder if it's actually doing something. Things that are more impactful typically have a higher risk profile, and that goes for anything in medicine, not just aesthetic medicine.
I do think these are the reasons that my skin stays looking good. And that way more than like filling in lines gives you, I think, a more youthful appearance.
Right.
And it's not invasive. I'm never going to get that crazy ass, you're bloody faced for 10 weeks or a 1 month. I can't remember. But I remember it was the O2?
I think she's talking about the vampire facial, which is done with PRP and microneedling. And I think that's what she's referring to here.
Anyway, CO2 laser, where the doctor, I had a new derm and she was like, have you ever had that? And I'm like, no. And she goes, is that something you'd be interested in? And I was like, I don't know. Should I be? And she goes, well, do you have young children? I'm like, well, I have children. Why? She was like, you basically couldn't see them for like 3 weeks.
Yeah, kids can be a bit, interesting when it comes to recovering from these procedures. They're very curious, and my daughter's the same way.
So I'm sure you got it.
I'll come back when I'm 70. Yeah, did not get it. So no, I only like the ones that there's really not a lot of downtime on, and they work great.
They do work great.
So I guess my takeaway from this video is that Megyn and Maureen are not anti-aesthetic procedures, but they seem to be a bit gun-shy when it comes to more invasive surgery. But again, sometimes invasive surgery can look more natural than some of the less invasive things that are out there. But again, it's not for everyone. But I also think that we need to be kind to those who decide to get surgery done, and whether they come out looking amazing, or to some people, maybe things look overdone or underdone, whatever it is. But, just be kind. I mean, they had it done to their bodies and they're recovering, usually physically and emotionally, since it is a trauma to the body. So I think we just need to give people some space and not be as judgmental. So in my celebrity analysis videos, you'll notice that I almost never comment on whether it looks good or doesn't look good. That's usually a sentiment that people will ascribe to the videos when they're watching them and in the comment section. But I stay very neutral because I don't feel like it's necessarily my place to judge that per se. Usually I'm commenting more on the actual procedures and, pros and cons of them. But everyone's going to have a slightly different aesthetic, and that's okay, So let's be kind. And I appreciate Megyn's viewpoint as well as Maureen's. And hopefully you got something out of this reaction video. Thanks so much, and please subscribe to my channel.